one case that is at Kawangware. Yesterday you did actually get 1 or 4 cases. I don't know what mechanism are you maybe planning to effect, particularly in those areas, because I understand the Kawangware market is still operating normally. There are so many people at the market center. Maybe as a government, are you maybe planning to close up the market?
My name is from KBC. CAS, Dr. Mercy, I would like to find out on the challenges that the government is facing, because we've been talking about rolling out mass testing, and that has not, you're still doing the target testing thus far, and from what you can see from other nations, mass testing is really helping in knowing how many people are sick, and then they could consider reopening the economy or slowly easing those lockdown restrictions. And then the other point, the other question goes to the CS for devolution. Sir, probably as the CS, apart from the people who've been affected by floods, status of preparedness in counties on COVID-19, would you say that probably Kenyans do not require any kind of aid, because most people have been asking for support, especially on food and other basic needs?
The last one.
Yeah.
Jimmy Mbogo from K24. Now, my question is, out of the 129 cases that have recovered, do we have patients that already had existing conditions, and how many are they? Number two, CS Omalo has talked about Mombasa getting additional support. Maybe what kind of support are we looking at?
Great. Thank you. So I'll start with the first question from NTV with regard to the case in Kawangware. Indeed, the idea is that, yes, Kawangware now is an area that's under surveillance for us, especially after this first case, but also an area that is under surveillance for us because we have actually been monitoring with regards to adherence of the containment measures. And we've identified markets as one of the possible areas of transmission. If we look at the response that has been put in place by our different supermarkets, you can see that there's strict adherence to masking, there's strict adherence to use of sanitizers where necessary, and there's also adherence in terms of social distancing. I myself was actually touring the market this weekend, and I was able to see that in the marketplaces, some of these measures are not being adhered to. And so going forward, what we're doing is that we're going to deploy more surveillance teams. You'll be seeing all the different markets which have been marked as possible hotspots, having increased surveillance, having increased measures in terms of fumigation. We have a team that has come together with a schedule of how that will look like, but also coming up with innovative ways of how Mama Mboga can still continue with her trade, but ensure that social distance is facilitated. And I think this is an issue that we'll be able to elaborate on further. We do now have the call to be on the ground and to do those spot checks, and you'll be seeing most of us there trying to interact with the public and even have lessons as to how you can correctly put on a mask. Like I said, during the weekend over at Kawangware itself, I could notice people had masks, but they were on their chins. So these are some of the measures that we're going to be putting in place. With regard to Purity's question on challenges that we are facing, indeed, we've told you in past press briefings, there are challenges in trying to run a successful turn of a test. The tests that we are currently conducting are known as molecular tests, PCR tests. And for you to be able to do a PCR, after taking the sample, you have to run it through certain steps and mechanisms to be able to get your end result. Because of the global shortage, every time we get the kits, for example, you've seen we've gotten kits from Jack Ma, and even the Ministry of Health has procured kits. Every time we get the kits have certain components that come together to be able to do a successful run. And the greatest challenge that we are facing right now has been with the supply of nasopharyngeal swabs. We have had a series of interventions and meetings with different players to see how can we domesticate that swab to be able to ensure that it's actually utilized properly to correct the sample and to run a successful test. It's important to note, in terms of capacities, the country does have capacity to run tests. In fact, almost 37,000 tests a day, we can run them. However, it would require ensuring that we have all those inputs and components that go into a successful run for a test. Testing be as it may, we have sat down and asked ourselves, if we do not have enough supplies, what shall we do in terms of measures in ensuring that containment is upheld, but also ensuring that there's a surveillance mechanism? And so what we will be deploying shortly is what we are calling seroprevalence studies within the environment. So taking an area like Kawangware and asking ourselves, the population in Kawangware, have they come into contact with any coronavirus case? And if they have, are there antibodies showing that? And so there's going to be a serosurveillance prevalence study being undertaken. Thirdly, we've read and say Purity has a temperature, she has these symptoms, perhaps we need to focus on Purity and test Purity. So there are mechanisms we are putting in place to ensure that at the end of the day, with the challenges that we have, we still have a surveillance system that is robust.